Hey ladies, it's Melissa. I'm here with my 18-week update. Woohoo! Um, I'm 18 weeks today. Today's Thursday, June 23rd. Um, Everything is still totally awesome, so I'm really happy. I had my ultrasound on Tuesday, as per usual, and everything looks super fantastic. My cervix is still Actually, my cervix, when they measured it this week, was longer than it's been any other time that they measured it. So it was like 4.11 at one point, John saw. Um, so that's really good. The placenta is moving out of the way. They checked the baby's heart this week, and that looks awesome. And the palpitations, some days don't bother me at all. Some days they're really pissing me off. But they told me that it was to be expected that they might get worse when I get pregnant, so and they still are nowhere near as bad as they were the first time, so I am just happy and thankful for that. And other than that, I feel really good. I have to pee a lot. um, that's about it. I'll feel like I really, really have to go. Like I'm gonna, you know, lose it if I don't get to the bathroom soon, and then I go and there's like not a lot. It feels like it's gonna be a ton, but so I guess things are just moving around down there and uterus is growing and taking up space. So I did go to the doctors on Friday because I worry about everything. If you watch my videos, you probably know this. And I kept getting this feeling like the only way I know how to describe it is like if I had a tampon in, but if it was like a short one. Like I could feel something. Maybe I'm just feeling my cervix, whatever. I didn't know what it was, but it was freaking me out. So I called the doctor, and she usually sees me in Worcester on Tuesdays. Every other day of the week, she's at her office out in Boston. So I went to work, and they called me back about noon, and they said that I was more than welcome to come see her in Boston if they wanted me to, if they wanted, oh, I can't talk. If I wanted them to check my cervix. And so I drove to Boston to see her. Of course, everything was perfect. She told me that a lot of her cerclage patients get that sensation, and she thinks that it's because the stitch is so tight around the cerclage. I mean, the cervix. I'm totally getting pregnancy brain in case you didn't notice. The stitch is so tight that if the baby puts any kind of pressure on it, you feel it more than you would if there was nothing there. Because if there's nothing there, it might just give more, and you just, the pushing down, like you would not feel it as much. So anyway, she said a lot of her cerclage patients feel that, and she wasn't concerned, but she obviously cannot get on the phone and tell me everything's fine without looking, because that just wouldn't be a smart thing to do. So she told me she's more than happy to see me every Tuesday and every Friday if I want. She's more than happy to see me in Boston. She said she wishes she could do home visits because she feels bad I had to drive all the way out. And I was just like, thank you so much for fitting me in. And she's like, no, thank you for driving all the way out here to see me. And I'm like, okay, whatever. I just felt, I told her I feel like such a loser, because I freak out about everything. And she had just checked my cervix on Tuesday, and here it is Friday, and I'm flipping out again. So anyway, anxiety much? Yeah. So then when I saw her on Tuesday, I did ask her, I asked her what happens if my blood pressure goes up at the end, because I have like sketchy blood pressure when I'm not pregnant. Every time I go to the doctors, I flip the F out. I'm sorry. Well, at least I didn't swear, right? I just said the letter. I flip the freak out. That's what I meant to say. And my blood pressure is always high when I get to the doctors. Then afterwards, I know everything is fine, I'm getting ready to leave. If they check it again, it's usually lower. But so I'm just worried. I have the potential for my blood pressure to go high, so I worry that it might later on, because I know in the middle of pregnancy, your blood pressure naturally goes down, but towards the end is when it can creep back up. And she said that we just watch it. She does not like to do medication unless it goes over 150 over 100 consistently, which I don't think it's going to do unless, there's something wrong. So if it's late enough in the pregnancy and the blood pressure is high enough, they'll just induce because they don't like to use medication. It has absolutely no benefit for the baby. The only benefit is to the mother, obviously, to prevent a stroke or something. So, yeah, so I'm, just concerned about that, but I'm going to try and watch my diet and make sure that I'm not doing anything that would drive my blood pressure up anyway. My sugars have been awesome. I've just been checking them. They're not going to do a glucose test on me because they already know that I have insulin resistance. But if you look at my blood sugar numbers, you would never know because they're perfect. They're like really, really good. So I'm really happy about that. I haven't gained any weight. I've actually lost 10 pounds since I started IVF. So, the funny thing about that, yeah, I lost weight, big deal, because I'm not a skinny girl. I'm 5'8" and I weigh 195. So I don't know. And I'm not showing. So everyone keeps saying, "Oh, do a belly shot, do a belly shot." And my friends on Facebook, "We want to see a belly shot." And I'm I'm not showing. It's not, there's nothing there. I can feel it, but it just doesn't look it. So once it looks it, I will do a belly shot. What else? Oh, and I also asked the high-risk doctor if she does C-sections herself, and she was like, "Oh yeah, I do it all, honey." And so I said, if something should happen towards the end where I would need to get a C-section, I want to schedule it with you and not Dr. F. His last name really does start with an F. I'm not calling him, a curse word. And she was like, "Ooh, that would piss him off." And I said, "I don't care. I have already had a surgery with Dr. T. I'll call her Dr. T. She's my high-risk doctor who I love so much. And I just feel comfortable with her. I completely trust her. I see her every week. The other guy, I see the midwife at his office. The midwife does not do C-sections. The guy does, or the doctor does. And I would just rather have somebody who I know and trust and have built a relationship with rather than just some random guy." So she was like, "Oh, you're so sweet," and whatever. So if I have to have one and it has to be scheduled or something, I am totally going to her. Also, if it's an induction, a scheduled induction, I'm going to her. I'm going to Boston. I don't care if it's out of the way, whatever. It's not that far. So that's that. Everything's totally great. Baby looks good. She tried to confirm again that it's a boy, but you guys remember the picture from last week. It is no question that he's a boy. So here are just a few pictures that I got. Nothing, spectacular. There's the little profile and his little belly. Oh, this is two little chambers of his heart when she was checking his heart. I'm pretty sure this is the bladder down here, this black spot. There's another view. His head looks like it's turned up a little more there. And one more view. They're all sort of the same. So yeah, that's all good. What else was I going to say? The only other thing I wanted to talk about is we are seriously considering banking the baby's cord blood, and possibly, I think you can do cord blood and cord tissue, because, I think it's a smart thing to do anyway, as, rare as it may be that something would happen, because we have, John's brother and sister-in-law have actually had 12 kids, and a few years ago, our oldest nephew, Justin, passed away at Boston Children's Hospital in Boston. He had lymphoma, and he was in the process of going through a bone marrow transplant. His sister, who's I think just a year younger than him, our niece Valerie, donated the bone marrow. They were in the middle of doing a bone marrow transplant, and some of the medication they were giving him caused an allergic reaction, which they failed to recognize as an allergic reaction. And when you have absolutely no immune system and your body's having an allergic reaction to something, it basically just, tears you up. So he actually passed away. And just in case what happened to him is something in my husband's family genes or something, I just would feel better having, banking the cord blood. It's pretty expensive though, so it's not really sure if we're going to do it or not, but I really, really want to if we can find a way to save up for it. So I think that's it. Um, yeah, my husband's almost home. He's making me baked chicken and a sweet potato and broccoli. So that's what I'm having for dinner, nice and healthy. Um, all right, that's my update. So I will talk to all you guys next week. Bye.